Take your temperature. A normal temperature range is 97.7 to 99.5 degrees Fahrenheit, 36.5 to 37.5 degrees Celsius. Anything above that is considered a fever and indicates that you are probably contagious. Having a fever with a cold is not as common as the fever associated with the flu, but either way it means you are contagious. Examine your mucus and nasal secretions. Thick or discolored yellow-green mucus is a strong indication that you have an upper respiratory infection accompanied by inflammation in the respiratory tract. It also means that you are most likely contagious. Children with thick white, yellow, or green drainage from their eyes usually are contagious as well, with pink eye also known as conjunctivitis. Look for a skin rash. Certain skin rashes are often a sign of being contagious. Rashes that affect large portions of the body may be either allergic or viral. Viral rashes are the ones that mean you are contagious, like with illness such as chickenpox or the measles. Some bacterial infections that are contagious can cause skin rashes, such as scarlet fever, caused by streptococcus, or impetigo, caused by streptococcus or staphylococcus usually. Fungal infections can even cause contagious skin rashes such as ringworm or athlete's foot. Watch for diarrhea, accompanied by a slight fever. Diarrhea can be a sign of having a contagious illness, especially when accompanied by vomiting and a low-grade fever. Diarrhea, vomiting, and a low-grade fever can be signs of gastroenteritis, often referred to as the stomach flu, or signs of rotavirus, norovirus or Coxsackie virus, all of which are contagious. There are two types of diarrhea, complicated and uncomplicated. Uncomplicated diarrhea includes symptoms of abdominal bloating or cramping, loose watery stools, a sense of urgency to have a bowel movement, and nausea and vomiting. Look for pain behind the forehead, cheeks and across the nose. Regular headaches are not usually an indication of a contagious disease. However, specific types of headaches, where you feel pain in the face and forehead, can be a warning that you are contagious. Headaches that accompany the flu, and sometimes a cold, occur as a steady pain in the areas of the forehead, cheeks and bridge of the nose. The swelling and mucus buildup in the sinus areas causes the discomfort. Notice if your sore throat is accompanied by a runny nose. When you have a contagious illness, like the flu or a cold, the sore throat is often accompanied by a runny nose. A sore throat without a runny nose but with symptoms such as a fever, rash, or headache, can be a sign of strep throat. This is a bacterial infection which is very contagious. The sore throat is sometimes caused by postnasal drip, as fluids from your sinuses drip down the back of your throat, causing redness and irritation. The throat feels raw, irritated, and painful. Pay attention to feelings of sleepiness and a loss of appetite. Contagious illnesses can cause you to feel very tired or sleepy, and to lose your appetite. Sleeping a lot and eating less are two ways in which your body conserves energy to fight infection. Recognize the symptoms of influenza, or the flu. Flu symptoms include fever, headache, general aches and body pain, extreme feelings of fatigue, and sometimes stuffy, runny nose, sneezing, cough, and chest discomfort. Influenza, or flu, symptoms begin more abruptly, progress quickly, and are more severe than symptoms from a cold. The flu also can lead to serious complications. Identify the symptoms of a cold. Typical symptoms that occur with a cold include a sore throat, stuffy or runny nose, cough, congestion, sneezing, mild chest discomfort, fatigue, and some general body aches and pain. Colds are contagious 1 to 2 days before symptoms appear, then continue to be contagious for the next 2 to 3 days when the symptoms are at their worst. Pay attention to combined symptoms. Symptom groups such as diarrhea, nausea, and vomiting accompanied by muscle aches and headaches can mean that you have gastroenteritis, sometimes called the stomach flu, or even food poisoning. Gastroenteritis and food poisoning have similar symptoms. This can make it hard to tell which one you may have. However, the stomach flu, or gastroenteritis, is contagious, and food poisoning is not. Consider the people you have been around that are sick. Most contagious illnesses can be caught for 1 or 2 days before symptoms develop. Learning what you have caught may be easier by understanding the recent illness of someone you have been exposed to, even if they were not yet sick when you were around that person. Also consider the time of year. Many contagious illnesses are more common during certain times of the year. Flu season in the United States runs generally from November through March. Other diseases may be specific to certain countries or regions. Rule out seasonal allergies. Some people have strong upper respiratory symptoms that are caused by seasonal airborne allergens. This type of illness is not contagious. Allergy symptoms overlap with those of a cold and the flu. Allergy symptoms include general weakness, stuffy, runny nose, sneezing, sore throat, and coughing. People with allergies often have a lot of itching of their nose or eyes. While allergy symptoms can make you feel bad, you are not carrying a contagious illness. Get the flu vaccine yearly. Scientists research and develop flu vaccines that are designed to prevent infection from the most likely strains of flu viruses. Every year the vaccine is different, so getting it one year does not protect you for the next round of flu season. Getting the flu vaccine is key in controlling the spread of the flu. The flu vaccine protects you from the flu, not from other contagious illnesses you may be exposed to. Wash your hands. Upper respiratory illnesses, like a cold or the flu, are spread from person to person. A common way these illnesses are spread is by touching someone or something that has been contaminated with the virus. Use soap and water. Wash with warm water and soap placed in the palm of your hand. Lather your hands by rubbing them together for at least 20 seconds. Be sure to cover all surfaces of your hand, including between your fingers, under your nails, and your wrists. Then rinse your hands well, use a paper towel to dry, and use a towel to turn off the faucet. Clean your hands with alcohol gel. Squirt gel into the palm of your dry hand. Rub your hands together, covering all surfaces until the gel dries. This takes about 15 to 20 seconds. Avoid contact with people that are sick. The flu virus can be spread by someone sick as far as 6 feet away. Coughing and sneezing creates tiny droplets that can travel through the air, landing on someone's hands, their mouth, nose, or inhaled directly into their lungs. Be aware of surfaces you touch. Doorknobs, desks, pencils, and other objects can carry the virus germs from one person to another. Once you touch an object that has been contaminated with the virus, it is easy to then touch your mouth, eyes, or nose. This provides a way for that unwanted virus to enter your body. The flu virus can live for 2 to 8 hours on surfaces. Protect yourself and other people from exposure. If you get sick, avoid contact with other people until your symptoms improve or your doctor says you are not contagious. In the United States, estimates show that between 5% and 20% of the population get the flu every year. More than 200,000 people are hospitalized each year for complications, and, each year, thousands of people die. The elderly, babies, pregnant women, and people that have compromised immune systems, or have asthma or other lung diseases, are at the greatest risk of developing complications. Stay at home, isolated from other people. Try to stay in an isolated room at home, separate from other family members, especially kids, to avoid spreading the illness. Don't go to work or school, and don't send your children to school or daycare when they are contagious. Cover your mouth when coughing or sneezing. Coughing and sneezing into a tissue, or even into the bent part of your arm near your elbow, is better than spreading the infected droplets into the air. Avoid sharing items. Bed sheets, towels, dishes, and utensils should be washed carefully before being used by other people. Be aware of other illnesses that can be contagious. While the flu and the common cold are certainly experiences most people have, there are many other contagious diseases, some of them serious, that should not be overlooked. Your doctor, or other healthcare provider, is a great resource for any illness or symptoms that develop that might be contagious. Watch for those around you who are diagnosed with a serious infection. Some forms of hepatitis are contagious, as are some forms of meningitis. These conditions are serious and should not be ignored. If someone you know has been diagnosed with an infectious disease, consult your doctor to help determine if you are at risk. Recognize childhood infections that are contagious. Most children receive vaccinations in their early years to avoid contracting serious illnesses, but sometimes contagious diseases can still be a problem. Discuss any evidence of infection or illness with your doctor or your child's pediatrician.